Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common condition I treat in the office is arthritis. Now, arthritis is just a broad term. There are several different types of arthritis. The most common is going to be osteoarthritis. Osteoarthritis is a breaking down of the joint. So what will happen is there'll be increased pressure on that joint over time, like say in your knee, and that will cause a narrowing of the space where say the cartilage is, and that can cause pain and discomfort, lead to increased swelling and irritation upon movement. Now, what causes osteoarthritis is a lack of mobility over time or to increase pressure on a joint over time. Now think of it as like say if you're very overweight and you put a lot of pressure on your knees over time, that can lead to premature development of that osteoarthritis and that breaking down of that joint. It's also common along the spine because we have a lot of pressure on our spine just from gravity and then all the sitting we do on a daily basis, and that increased pressure over time will develop the arthritis along the spine there. Another common arthritis we see is called rheumatoid arthritis. Now, rheumatoid arthritis is an immune response where the body actually attacks the joint. And what happens with this type of arthritis is the joints become very disfigured and very different than a typical joint there. They'll be kind of misaligned, they'll be really swollen, very hot, and a lot of times it'll affect the hands and the feet. A lot of times what we can do for that is we just can reduce that swelling inside that joint. In our office, we use laser therapy to reduce that swelling along the joint. But again, it's an immune response, and a lot of times these patients need to take a medication that will control that immune response throughout the body. Now let's talk about ways that you can slow the development of osteoarthritis. The biggest thing that you can do is to reduce the pressure on that joint over time. So for example, if you're overweight, obviously trying to lose weight so there's not as much pressure on your knees will slow that spread of it. But more importantly also is you want to increase the movement of that joint. So if a joint is not moving properly or it's very stuck, that'll often produce a lot of pressure on that joint and accelerate the arthritis process. So like in my office, a lot of times, again, we see a lot of arthritis develop in the spine, and a lot of that is due to lack of range of motion and lack of mobility inside the joint. So we use a chiropractic adjustment to restore that mobility and take the pressure off the joint. And that will help to decrease the arthritis development over time. So again, the biggest thing you want to do is increase that mobility of that joint. So whether it be your shoulder, we want to put it through a range of motion as much as we can. That's why exercise is great, because again, it's going to put it through a range of motion, and that's going to help to decrease the stress on the joint. So I hope that answers a common condition we see with a lot of patients. If you have more questions, reach out to me at 703-912-7822 or schedule online at novacarwellness.com.